A hospital with no billing counters. Yet it's a reality, and in fact, this reality is leaving its legacy behind for the past 12 years. I'm talking about the Sathya Sai Sanjeevani Hospital, which is located in the heart of the country here in Chhattisgarh's capital, Raipur. And we have the chairman with us, Dr. Srinivas, who has been the heart of this entire hospital. So tell us about it, how it has been leaving this beautiful legacy and stories behind, how it has been providing not just free pediatric surgeries and consultations, but also free food to the parents, accommodation and logistics.
Thank you very much for coming and having us on this show. Sri Sathya Sai Sanjeevani is an institution created by divine will. It was the wish and directive of Bhagawan Sri Sathya Sai Baba, the founding father, to continue his services to humanity in the field of healthcare. It was his direction that I should come to Chhattisgarh and start an institution of public service for the nation. At that time, the Government of India, Secretary of Health, Shri Kesav Das Deshiraju, who was a good friend, guided me in saying that, Srinivas, we need to invest in the children of the country. The health and well-being of children will give us the future that we look forward to for the nation. And that is how the investment into children commenced here in Chhattisgarh. As you would be aware, Chhattisgarh in the year 2011 was a difficult destination to come to. People were a little skeptical of my going here, but to me this was a will of Baba that I should come here and nothing else mattered. We did come here and then we met the Chief Minister, Dr. Raman Singh, at that point with the assurance that we would build an institution in the service of the state and the service of the children and families of the state. So we procured a land from the government of Chhattisgarh, and as a promise given to him, we built Sri Sathya Sai Sanjeevani Child Heart Center in a record 1 year. The first surgery was performed on little Keerti Verma. Coincidentally, she is here today for a checkup. Today, over 36,000 children have been operated in Sathya Sai Sanjeevani from every district of India, from over 21 nations of the world. And this child was the first operated by Dr. Sampath Kumar, Professor Head of AIIMS, New Delhi then. And that she is here is a divine coincidence of sort. So, Smriti, this institution would be defined rightly as an institution first of public service, because it has always been the mandate of Baba that all services must be provided free, because they germinate and originate from the principle of love all, serve all, which was a guideline he had given us. And when you consider everybody as your very own and care is provided, obviously there is no billing here. And this has been a great model, and especially child heart care, which was then conveyed to us as the commonest defect at birth amongst newborns in India, needed an institution totally dedicated to alleviating this problem. Yes, it was a task to commence this in the central Indian developing state of Chhattisgarh. As you're aware, to do high-end super specialized work requires the functioning of specialists, and I was fortunate through the kind guidance of my good friend Professor M.S. Valyuthan, who's sadly no more today, who guided me to get the first batch of pediatric cardiac specialists to come and serve here. That we have today been able to access children from every part of the country. They come in large numbers today, speaks of the testimony that I can give to the brilliant Sathya Sai Sanjeevani teams. this is in essence an institution of nation building, because children, when given this gift of life, as was done a short while ago, is a gift they will cherish of having received something which was so precious to them. And this would be given back in the service of the community, the nation, and the world tomorrow. It would be interesting for you to note that we did a little experiment on this. When we observed the 10th anniversary of this hospital, I told the team in the hospital to write a small note to the first 3,000 families and convey that we are observing the 10th anniversary on a given date. And would they be willing to come back and light a lamp for the children of the world, praying for their well-being and wellness? It was just a thought of offering. And you will be so happy and heartened to know that close to 4,000 families on their own converged here from as far as Fiji, Nigeria, Afghanistan then, and to every part of the country, right from Arunachal Pradesh, Nagaland, down to Kerala. They came here in large numbers and lit a lamp of life and love for the children of the world, which today is a Guinness World Record for the largest number of children operated for child heart disease to come back to their institution of care and give back this gift in whichever form for the benefit of the nation. So what really we do here is the completeness of child care and child health. We begin with operating and serving children who are coming in large numbers with heart disease. The only access and condition that we can care for is in the form of a surgery. You can do nothing else. This is a painstaking, laborious surgery which requires great human skill, expertise, and capability, because child heart care surgery does not give you a second chance. You have just one chance and you have to be very good at it. I'm proud to tell you, as an Indian and as a member of now in this center in Chhattisgarh, that Sathya Sai Sanjeevani's record for success in surgeries is best in class in the world today. It speaks volumes of the painstaking efforts teams put in here. It's because the premium here is only the life of the child. There is no other factor which guides teams here except to save that child. Children have stayed here for as long as 120 days. Very recently in our center in Palwal, Sumi, you'll be happy to know, there was a child from Haryana who was operated, and she stayed for a long period of 125 days in the ICU. She underwent 3 corrective surgeries and had to stay that long. Just a month back, the head of Haryana came to congratulate the baby. She has become the karate champion in her age group for Haryana in an international karate competition. So a child operated for congenital heart disease today can lead a normal life. You will see today in the course of your tour of the hospital, they are brilliant dancers, they are in the administrative services, they have gone on to make corporate careers, but everybody with one single focus, that I must give back to society.
Absolutely.
So this is the goal of Sathya Sai Sanjeevani in saving lives and giving lives for the service of the nation.
Absolutely, sir. That's commendable. And I'm very glad to know that, as the legacy you were mentioning, but I want to also know the admission process that one has to go through. What is the process for all those who will be watching this across the country? What is the process for an admission in this Sanjeevani Hospital?
That has again been a test I put myself through. We exist in a relatively unserved geography.
Correct.
So the greatest spread of awareness of Sathya Sai Sanjeevani has been through its own beneficiaries who've benefited from the treatment and surgical intervention provided to them. they have become the ambassadors who have spread this message far and wide.
Yeah.
And today, it may not be a boastful statement that if any child who has been afflicted with heart disease, the first name that could come up with any doctor or caregiver in any remote rural part of this country would be Sathya Sai Sanjeevani. So the first step is any child confirmed with a problem in the heart, which is only detected but not confirmed, the name that would come up is Sathya Sai Sanjeevani. As regards the process of coming here, anybody can come here as long as they are afflicted with a detected issue relating to the heart. It may not be confirmed because, as you are aware, technologies and expertise is not available in rural, tribal, Adivasi populations where you can confirm a heart disease. Obviously, they have to come here, and that is how we see large numbers coming here. That is how today, at the gates of the hospital from 3 a.m. onwards, queues of families from every part queue up here. So there is no discrimination or differentiation as to who can come. Yes, the name has spread far and wide. ये बच्चों का दिल का hospital है. So that has spread now. So only those afflicted with heart disease come here. There is no age restriction again, though in the Western advanced world, congenital heart diseases are treated quickly and at early stages of life. Sadly, in our country, detection and screening takes time, so we see children 20 years, 25 years. We've seen children and seen cases where simultaneously a mother is operated and her baby is also operated. So this is because of the developing stage of healthcare and screening in our country. So children come here in large numbers from all parts, and they come here and they go through a process of assessment. Everybody is provided first consultation, detection, screening, and investigation. And then if found necessary for immediate and emergent surgery, they are taken up immediately. Otherwise, we wait to improve the condition of the heart. Sometimes they are very malnourished, they have multi-organ issues, they have nutritional challenges. So these have to be taken care of before you can touch the heart for a surgery. So the name has spread far and wide, and today I think we are at a stage that Sanjeevani is a recognized child heart care hospital across the country.
So is there any assistance from the state government as well? Any assistance that the state government is lacking, or what kind of support the governments are giving you?
To do public work in the public domain, as a personal philosophy, I believe, you would have to align with the programs and the endeavors of the government. Vis-a-vis the answer to your question of what support do you receive from the state government, I must say that the state government has been welcoming in having us come here. They have played their role, but as you're aware, Chhattisgarh is a growing, aspiring and developing state. I must be honest that my expectation was limited, and I believed that you would have to walk your own path to build your own strengths and capabilities and add and aid the state in its progress and growth. Because these expertise are not available in this part of the country, or they're very limited in the country as a whole. And to expect anything in the state of Chhattisgarh would be too much of an ask. But all in all, I believe that we have been warm and very respected partners of the government. The state immensely respects the work we do. They have high regard for the work that we have been doing, and especially we are particular that we touch every family of the state in which we operate. What do I mean by that? Prevention is better than cure is a statement we all hear. So we have massive outreach, public health, community health programs where we go into the geographies of the state, address issues of health and well-being of the different districts of the state. And thereby, I'm pleased to tell you that today, almost every child in Chhattisgarh born and to be born is being detected and screened for congenital heart disease. And also, we have focused on improving young adolescent girl and maternal health. Again, a vital healthcare parameter. This we have done through a program which and I personally am very fond of it, which is called Educate, Empower, Employ. You're aware that Chhattisgarh is a tribal state. Most of its population lives in the tribal districts. A large number of the girls in the tribal districts today work in Sathya Sai Sanjeevani centers because we have used them in educating and empowering them, and they're employed here today. Thereby, we have lifted the profile today. You will see them in our research foundation. You will see them in the operating rooms. Today, they're top class. I'm happy to tell you that we have a best-in-class nursing education institution here, where we educate nurses and especially all the children from tribal families. Today, they are brilliant to work with. And I have seen that the tribal youth is hungry. They want opportunities, and they grab opportunities with both hands. And this is the great equalization of the field we are bringing about. It is easy to get a well-educated convent school girl to come and work here. But we focus on rural and tribal children. Today, they can stand shoulder to shoulder. Very recently, we have won prizes and accolades in nursing conferences and in cardiac conferences, where these children have proved to be one amongst the best. So I think India needs and the state needs a level playing field, not just for economics, but for healthcare and education also. States which have not yet made their mark, I think this institution can play a role, which it is already beginning to. Today, there is so much focus on Chhattisgarh. In fact, very recently, the Secretary of Tourism was telling me that when there was a state national tourism conference, when Chhattisgarh's turn came to speak up, the first word that was mentioned was, oh, that is the state famous for the Child Heart Hospital. So today, the signature of Chhattisgarh has become Sathya Sai Sanjeevani to provide child heart care to the children. It's also a testimony to this institution and to the progress of the state that children from every developed part of the country come here for care and cure. And I think that is something I feel good that we are helping in the progress of the nation. We speak of Viksit Chhattisgarh, we speak of Viksit Bharat. But progress has to be comprehensive and well spread. It cannot be in pockets. And progress is a function of a value system where I believe whatever I receive, I must give back in greater measure for the welfare and well-being of my nation and the people of the nation, which is what Sanjeevani is doing.